called. I'm the Director of Product Management for HydroWorx. Before we start, just a couple of things to note, housekeeping items. If you have questions throughout the presentation, please feel free to enter them in the chat pane to the right of the video screen. We will make sure to have them answered during the live Q&A session at the end of the presentation. Additionally, we will put a link to a survey in the chat pane. Please fill this out so we can continue to provide relevant information relating to HydroWorx products. We're very excited today to be introducing this new product, the HydroWorx 300 series. I'm going to speak a little bit about the product features and functionality prior to turning it over to Dr. Hetrick today, who will present some clinical protocols and exercises that can be performed in the 300 series by an aging population. The 300 series is an underwater treadmill system that contains all the same benefits as our therapy pools with integrated treadmills, but in a smaller footprint that can be a non-construction based product and fits through a standard doorway in almost any facility. There's three main components to the system. There's a stainless steel and glass treadmill trainer, which we see here behind the partition. There's also a water storage tank and a plant equipment pack. All three of those items fit through a standard 36-inch wide doorway. I'm going to move inside the trainer now. Opening the door is a simple two-step process. I rotate the latch, pull down on the handle, the door opens. Then you can step inside. Just a couple of things I want to point out in here is one is a safety tether. We recommend that each patient attach this to their left wrist and utilize it. If at any time they get in trouble, they could pull that. It'll stop the jet flow, it'll stop the treadmill, and also drain water out of the chamber. The other unique feature in here is the fold down seat. This is a great item. It easily folds down and easily folds up. If someone is a little lower functioning level, they could use it to sit on while the chamber's filling up, and also you could use it to do some seated exercises. Doc Hetrick will get into that here in just a few minutes. Doc's going to bring Ken up now, and you can see Ken is in a wheelchair using the very comfortable ramp here. Moving inside the chamber, Ken's feet are inside using the very comfortable handrails here. Moving forward, Ken, why don't you go ahead and fold the seat down there. Turn around and sit down. Safety handrails on the side of the chamber here. There's a handrail on the front also to use the treadmill. I'm going to close the chamber now. It's a two-step process. I push the door closed and I rotate the handle to latch it. Going to fill the treadmill chamber up now with warm water. It's an easy one-touch control here. I'm going to hit the 4-foot mark. I'm going to confirm that the door is actually closed on the HMI. Now the water will start coming up and it'll fill in around Ken here. We typically recommend keeping the water about 90 degrees. It can be adjusted anywhere from room temperature of the facility up to a maximum of 104 degrees. There is a digital control on the heater on the equipment pack, so you can adjust the temperature in 1 degree increments. There's a touchscreen control here. It's kind of divided into a couple of different sections. On the left-hand side here is the water depth control. There's some quick reference buttons here. I've selected 4 foot, so the water is going to come up to this point here, the 4-foot mark. You can use the up-down arrows to adjust it in 1-inch increments up and down. On the right-hand side is more related to the speed. We'll get into that in a little bit detail later. But now there's kind of two modes. There's a therapy mode. There's a sport mode for slower and faster speed ranges. You can also adjust the treadmill in 0.1 mile per hour increments also. Let's see, treadmill goes from 0.1 to 10 miles an hour. You can adjust it in 0.1 mile per hour increments. At the slow speeds, it's a very strong, smooth flow. A lot of land-based treadmills go to a minimum speed of 0.5 miles per hour. This goes all the way down to 0.1 mile per hour. Also, there's lights on the system. You can see I just turned the blue lights on. We'll show that when we start the treadmill. The blue lights are kind of for, makes the whole system look a little better, but the lights flash when we start the treadmill. It's a nice safety feature also. We've also got an optional video system that comes with this. You can see up here in the left-hand front corner of the chamber, there's an iPad that's mounted there. It's getting a live video feed. You can see Ken's legs. It's getting a live video feed from a GoPro camera that's currently mounted on the left side of the chamber. That GoPro camera could be mounted on the back. It could be mounted on the side, so you can do some gait analysis with it. I could be holding that iPad in my hand also, and I could be looking at the gait. I could be looking at it with Ken. The Aquatics textbook will also be loaded on that iPad, and all the HydroWorx protocols from our website would be accessible from that also. Ken, let's go ahead and have you stand up here. Fold the seat up. There we go. And then go ahead and put the safety tether around your left wrist, Ken. Have him put the safety tether on, and then we'll start the treadmill here just a little bit. The nice thing about the touch screen here is it pivots, it moves in and out. I could be using it as a therapist on the outside of the chamber. If I set Ken up for his session, wanted him to adjust the speed a little bit, he could control it from inside. I'm going to set it to 0.5 miles per hour. I'm going to hit start, and when I hit start, you'll see the blue lights flash. That's a nice safety feature of this system, so a visual indicator it's starting. I'm going to go ahead and hit start, Ken. Okay, you can see the lights flashing. Ken starting, going about 0.5 mile per hour here. From the touchscreen controls, we talked about the water on the left side here. It also has an integrated jet, which most HydroWorx systems do. I'm going to turn the jet on here for just a minute. You can see the water flow there creates resistance. It's also a great massage tool with the massage hose, which Doc will show in a little more detail. Got the lights, got a pause button, got the massage hose that attaches onto the jet. That's kind of a quick overview of the 300 series at this point in time. If you have any questions, please enter them in the chat pane on the video screen. We'll have about 20 minutes at the end of the session to answer those questions. I'd like to turn it over to Dr. Hetrick, the president of the Hetrick Center and inventor of the great HydroWorx 2000 series product also. Here you go, Doc.
Thank you, Patrick.
You,
Patrick always does a great job, as you can see. Real excited about having the opportunity to be here with you today. I'm going to ask Pat to stay up here and talk with me a little bit and work with me on a couple of things. This webinar, if you will, is talking about the aging population. So what do we mean about that? Well, you know what? Unfortunately, that includes me. I'm 61 years of age. I'm getting into that. Ken, how old are you?
75.
75 years young. So he's very young, okay? And let me tell you a little bit about Ken, because he's doing us a huge favor. Ken has been a personal friend of mine for a long, long, long time. Most importantly, he's an ex-Marine, so you know he's a tough guy, and we thank him for his service to our country. And a great entrepreneur, and has done wonderful things. And again, I can't thank Ken enough for doing this for us. Ken has also been over in our clinic. He does a lot of wellness programs in our other pool, the 2000, so he's been in the pool. And this is his first time actually experiencing this treadmill. So be interested to see what his comments are, because that was kind of a blind thing we wanted to do just to get a real fresh opinion from someone who's never experienced the pool before. Now, we were talking about the aging population, so let's talk about two factors that occur as we age. Now, these aren't the only things that happen as we age, but they're two major factors. Number one, we lose flexibility. So why is that important? Well, if I've lost flexibility, I am a huge risk factor of falling. And as we age, if we fall, you know, we may end up with just a small sprain. We could end up with a fractured hip. A lot of people are on blood thinners. You hit your head, could have a major brain bleed. A lot of difficulty as far as that. So flexibility, really important. So Patrick, come on over here for me. Now I want Patrick just to demonstrate. Give me a normal stride length, Patrick. So as we can see, that's his normal stride length. That's what we normally see. Now come on back, Patrick. Now I want you to show Patrick what would be someone that maybe has a little bit of an issue. The stride length gets very shortened. Now in a shortened position, the real key to this is he's real easy to knock over at this point in time. So he could fall real easy. Now go into your normal stride length. At this point in time, Patrick's really steady. He's sturdy. He's not going to fall. I don't have to worry about Patrick at this point in time. So if he loses flexibility, he loses that stride length. He loses that stride length, he's now a fall risk. Now, step on down here for me, Patrick. This is an 8-inch step. This is not different than what you're going to do going into a house, a commercial building, anything like that. if he loses his flexibility, whether it be in his hips, his knees, his ankles, whatever the case may be, when he goes to get up, boom, he hits it. When he hits it, he's not aware that he didn't clear. When he doesn't clear, boom, he ends up falling down, and now we have an injury that occurs. So if we can get his flexibility, now all of a sudden he can get up there without a problem. Now, that's flexibility. The second thing that happens, you lose muscle strength. Now, the beauty of the fact that if you lose muscle strength, it's okay, folks. We have research showing that you're 98 years of age, you can still increase muscle strength. That's not a problem, okay? But the problem is motion is initiated by the muscles. So we have to make sure that in this situation, Patrick, come on over here again for me. When Patrick goes to stand up, he's got to have enough strength in his quads, be able to stabilize with his glutes so that he can make that movement and get himself up and then push off and be perfectly fine. So if he loses muscle strength, he can't do a simple, we refer to it as a purposeful movement. That is something that he needs to do for his normal, we use a term in the industry called ADLs, Activities of Daily Living. So it's really important that he can do something so simple as that. Now, Patrick, you were handling that chair for me. Bring that over here for me, if you will, please. This is what I like to do with my patients all the time. They come in the office, and I actually am going to demonstrate this 1 second, if you don't mind. And what we do is we have patients that will come in, and we'll say, you know, where's your problem? They say, well, you know, I have lower back problems. And I say, well, how's the lower back problem come about? Well, it seems to be really irritated when I go to sit. Here's how the patients sit. They get about this point, and then it's a free fall, okay? Total free fall. Now, the problem with that is the fact that I had no muscle tone to be able to decelerate the movement to be able to sit on that. So when I do that, if I have osteoporosis, osteopenia, any of those things, I can now develop a compression fracture. The other thing is, Patrick, come on over here for me again, if you will, please. So Patrick's going to do the free fall, which we normally see. So just go ahead. There's where most people do. And then when they go to get up after sitting for a while, my patients will say, well, I got shoulder problems, I got neck problems, I've got elbow problems. Well, why? Look where his neck's at. Look where his shoulders, how he used them. Now in this position, he makes that first movement, step forward. Boom, he goes down, okay? So lack of flexibility, lack of muscle tone, extremely important. So we want Patrick to learn to hip hinge, so he's going to have his first movement there. He sits down nicely. When he goes to get up, if he's got strength in his quads, he's got strength in his hips, he can get up without any problem. Perfect for us as we get older. Because once we can't get out of a chair, you know where we're going. We don't want to end up in that facility where we now lose our independence. We want to maintain our independence. This is the first time I've ever been taller than Patrick, by the way. So I feel really good. All right, now the next thing, let's bring a walker in here for me, Patrick. This is something we see a lot of patients use on a regular basis, is a walker. I understand they're important. The problem with the walker is that in this situation, we're putting a lot of stress into his wrists, his elbows, his shoulders, his neck is forward. And then when he goes to walk, now this one admittedly, isn't sliding, he's got that very shuffled gait. And that shuffled gait, again, makes him susceptible to falling. So I think I've certainly killed this whole point about flexibility and about loss of muscle tone. But those are things we want to be able to do. So now how are we going to affect that with Ken? Well, we can see here, Ken's walking right now. Now, Ken, I want you just to increase that stride length. Just open up that stride. There you go. You can see now he's got this ability to be able to, if you will, float, because he's now able to go ahead and have time for him to be able to place that foot down, lock it in, and be able to go through locomotion in a purposeful movement. If he tried to do this on a treadmill, he couldn't do it on a land treadmill. Why? Because, Ken, I hate to ask you, but what do you weigh? He weighs 145 pounds. I mean, feel good. No. He weighs 240. So at 240, he's got a lot of compression on his joints. So if we look at the joints, what happens as we age? The joint starts losing the cartilage. As we lose cartilage, now we're getting close to bone on bone. We already have arthritis. What does that do? That creates pain. In the water, now we have this thing called buoyancy. We didn't have to create it. Water creates it for us. This thing called buoyancy now is taking Ken from 240. He probably weighs about 65 pounds in the water right now. 65 pounds, Ken can go forever and ever. He doesn't know he's going to do that today, but he's going to go forever and ever in the water because he doesn't feel the compression of the joints. So now we can work with him, get that gait stride opened up. And now, Patrick, I want you to just go ahead and pick up his speed. Because the next thing we want to do is we want him to be able to go ahead and be able to go a little bit quicker. So now he's going a little bit quicker. And now we're going to go ahead and he's going to get himself into a little bit of a jog. And we don't even have the jets against him at this point in time. But that's very easy for him. You can see the fact that if he tried to do this on a land treadmill, he'd be pounding away at those joints. He'd be in a lot of pain. Now he can do this very easily. He's got the handbars in here, the handrails, so if he needs them, he can grab a hold of them. But for the most part, I don't want him to do that. So Ken, get those arms moving. I want them moving to your side, just like you're pumping like you normally. Let's give him a jet now. Now he's going to turn on that jet, and now we're going to be able to go and see him work a little bit harder. So now with the jets, he can work harder. And what this is doing now, we now have the flexibility of the joint. We've opened up those joints, everything from the lower back, the thoracic region, or the mid back, into his hips, into his knees, into his ankles, and he's not feeling the pain. Now, the other thing, we've turned on the jet, so we're increasing the resistance. Now he's building up muscle strength. Okay? So he's doing all this without any pain. This is very comfortable for him to be able to do. While I like people walking forward or running forward, that's not where it's at in my clinic. Okay? So we're going to shut down the jet. We're going to turn down the water or the speed of the treadmill, and we're going to have Ken turn backwards. I like people to walk backwards. Why? Because I see too many of my patients bent over. I want them to be able to stand up straight. So if I walk him backwards, let's turn on the jet again for me, Patrick. When he has that jet on, that's going to force him to be able to go into a little bit of extension. When he goes into extension, that's where he's now going to be able to go ahead, work his lumbar extensors, work those muscles. They're part of the core, and he needs to work his core so he has stability, so when he's walking, he's not going to have a problem. This feels very comfortable. Do you like that jet against your back?
It feels wonderful.
Yeah, the jet gives him the ability to also get a massage at the same time. So he's keeping the muscles nice and relaxed. He's also now working on strength. He can increase his gait length, so I want you to increase that gait stride for me. Get those arms working a little bit more for me. Just keep them nice. That's it. Nice stride. So we can see the fact that I'm always looking at him, and that's the beauty of the pool. I can see at all times. I can back away. I can get up close. I can look to see, do I like how he's putting his foot down? Is he got the proper motion of the ankle, the knee, the hips? Is all those things looking good? As we said, we could do a GoPro camera from the front of the pool. We could see him from the front or from behind. Any of those things so we can watch and be able to analyze his gait. So it gives me that ability. I can see that right now. I can look through here and see the fact he's placing his feet well. I don't see an issue as far as that's concerned. Now, anybody can be decompressed. I can put you in a harness, and I can put you on a land treadmill, and yes, you're not going to weigh 240 pounds. But here, folks, here's the most important thing. You're doing this in water. Water's the key. Why is water the key? You know, thank goodness it's available to us, because it did two things. It made him buoyant. I didn't have to move the rigging around so that he could walk backwards. Ken, let's go sideways now for me. So Ken's just going to do a little karaoke or a little crossvine. And now we can see he's going to get a lot of good stretch in his hips. We did that like that. We didn't have to rehook him up. We didn't have to do anything. It happened that quickly. We can take him in any position, 360 degrees. Sorry, I get excited about this stuff. 360 degrees, we can take him any position that we want to go into, and he can now move. Now, let's get back to this thing called water. Why is water important? There's a property of water called hydrostatic pressure. This is where I get excited, like you haven't seen me so far. All right, and hydrostatic pressure, what that does is that is the same effect of taking 17 ace bandages, wrapping around from his feet the whole way up to his mid-belly point or chest. So when we do that, the important thing here is the fact he has 6 quarts of blood in his body. Now, along with blood, he's got lymphatic fluid. What does the fluid of your body do? It sends nutrients to your tissues. Nutrients in your tissues are the things that heal the tissue, that makes the tissue healthier. So whether Ken had an injury or whether Ken is healthy and he wants to maintain his health, he wants to be able to get blood flow to the cartilage, blood flow to his muscles, we can do that because we've now made a more efficient pump called the heart. So 30% of the blood flow will now go to his heart, 30% of his blood flow goes to his lungs. So now his heart is a much more efficient pump. he doesn't have to work as hard. When he walks in water, he's 10 to 15 beats per minute slower, his heart beating slower in water than is on land. So here, even if he had a cardiac issue, he's not going to stress his heart out as much, but yet be able to work harder to be able to work the muscles because his heart rate's 10 to 15 beats per minute slower. Now, along with that, the other important thing is his lungs. How do we exercise lungs? Okay, you can go out there and go in. There's something called aerobic and anaerobic. I can take him out there and I can run him as fast as possible, but let's be realistic. I like Ken, but he's 75, okay? He's not going to be able to go out there and pound and get into an anaerobic phase. In the water he can. He only weighs 65 pounds, so I can do that. But I don't have to take him to anaerobic phase. Because his heart rate will stay 10 to 15 beats per minute slower, I'm now able to turn over the blood flow through his whole body. So now I'm able to get oxygen to the tissues. I'm able to go ahead and get nutrients to his tissue. And then most importantly, I'm able to get rid of waste products. How many times do I hear my older patients say to me, I don't know, doc, my ankles swell, my feet swell, my legs swell. And I say to them, how much are you getting up throughout the day? Well, now that I have remote control, I don't even have to get up for anything other than to go pee. So they're not getting up and moving. All right? So if you're not moving, think of that pond that doesn't have water. It looks bad. It's unhealthy. It smells. Okay? Well, that's the disease that's going to happen if we don't start moving them. So cellulitis, big thing that we see with a lot of our patients. Heart failure, big thing we see because we're not working these systems. So now we can work his heart, we can work the lungs. So I was at the lungs. Sorry, I'm old. I keep going all over the place. So the lungs, let's talk about that. I have the effects of 17 ace bandages wrapped around his chest region. Every time he has to breathe, he has to use the muscles of inspiration. He has to use these muscles to help himself breathe. Now, because we put more blood flow up there, he's able to now, those hemoglobin molecules, the blood cell molecules, are able to grab hold of the oxygen. I've increased oxygen to his tissue. So we have more oxygen. We have now nutrients going to his tissue. And you know what? Is this fun? Is this enjoyable? It feels good. You know, what could be better? Okay? I don't have to tell Ken, I'm sorry, you got to come back tomorrow or next day. Ken wants to come back. You don't have to force him. This is enjoyable for him. So it's very easy to get compliance, which is a huge factor we want to be able to see on our patients. So we can do all different types of movement patterns. We can run him. We can have him do complicated movement patterns, the purposeful movements that we talked about. We can make them more complicated for him, all those different things. Now, let's turn off the treadmill for Ken. And now the important thing, as Patrick said, Ken could have done all this on his own. He doesn't need somebody else doing this for him. So if you're into a facility in which you want the patient to do it, the patient can do it themselves. Ken, let's take the seat and let's lower it down. All right, he's going to get rid of the wrap he has there. And now we're going to give him the hose. Let's put the hose in for me. And he's just going to insert the hose now at this point in time. And when he puts that hose in there, we're going to show you now being able to use the massage hose and the importance of being able to do that. So Ken, let's just have you sit down for me, buddy. Now, before we even get started with that, let's do one thing. Put the hose behind there. I'm old. I forget what I was going to say there. Now, let's just go ahead. Watch Ken now. We talked about getting up and down from a seated position. Ken, I want you to go ahead and just stand up for me. Now, was that difficult? Okay. Now, why wasn't that difficult, Ken? What did you feel when you do that on land and when you do it in water?
Well, it was buoyancy. It was pushing me up.
That was the key. Ken used the term buoyancy, and as he said the water helped push him up. So now, if I'm working with Ken, and let's say that I got to go ahead, and he doesn't understand how to use his hips, and he's using his arms and everything else, because I don't want him to use the rails when we start working with him. So now, Ken, put your butt back, sit back with your butt. Now look at that. That was a perfect hip hinge movement pattern. That's how you sit. Not this free fall where you end up smacking your backside, get a little whiplash of your neck and everything else. Now, when he goes to stand up, stick your chest out, get your head up, and push up. And he pushes up. He's using his hips. He's using his quads, these big thigh muscles. He's using them instead of using his arms, instead of using his wrists, instead of creating problems to his neck. he can now do these things very simply. So we can just work with him. Maybe we have him in the water just getting warmed up, loosening up, doing his treadmill. Now we might want to work with him on just being able to learn how to sit properly. I'm telling you, that's huge for the average patient to be able to learn how to sit properly. Now, let's go ahead and go back down there and sit for me. Now, let's just go ahead. Not yet, no. Now, what we're going to do is what I want you to do, Ken, just go halfway up. Okay? And now sit back down. So maybe we just want to use different range of motion. We don't want to use the whole thing. If I want him to work a little bit more on just using his toes, just go on your toes and push up with your toes. Now, go up. Now use your toes and go up on your toes now. Way up on your toes. Okay, now come back down. Now go and sit down again for me. Now from the seated position, just go up on your toes now. Yeah, that's it. So all I want you, don't even worry about getting off the chair. Just work your toes. So now he can go ahead, and if I just wanted to work, so I'm working his calf muscles, I can work his calves now. If I want to put a little bit more resistance, put your arms on your thighs and push down now, buddy. Okay? Now I added resistance. As simple as that, but that's a good thing for him to be able to work his legs. If he now just has a mobility issue and we don't have good flexibility of the joints, you can stop that for a second. Take your leg facing me and just bring it straight out. So just, there you go. So if I want to work on just range of motion of his knee, all he has to do is do that. All right, very simple. Is that hard to do? No, the water's doing it for him, okay? He doesn't have to do anything. The water's doing it. He's initiating the movement by muscle, but the water takes it through it for him, so he's going to increase that range of motion. Now let's put the jet onto him. Sorry about that. So now as we bring the jet over here with the hose, this thing, I love this thing. This is such a great feature. We're going to turn this on, and I want you to watch what we call fascial displacement. I want you to just see, look at the depth of penetration that we're getting in that muscle. Does that hurt, Ken? No. There's no pain. I'm telling you, if he went to my massage therapist in my clinic and they went that deep on him, he'd be off the table. That's painful. It's not painful here because he already has the hydrostatic pressure. He already has those 17/8 bandages wrapped around there. And so now, being able to do this, if he wants to work just the joint, let's get down to your knee, he can now just take his leg, straighten it up, bring it down, and work with that. And now he can just go ahead and use that. So any part of his anatomy that he needs to work, if he wants to work his wrist, he could do his wrist under the water. He can do any part that he wants to with the hose. Makes it extremely functional. Now, one of the other things that we can do, let's have you stand up for me. Keep the hose going. Keep the hose going. Just don't take it out of the water. Okay. All right. Now, turn around, if you will. Now, can you put the seat up and still hold on to the hose for me? All right. Now, let's go ahead and let's have you walk for me. Turn on the treadmill.
0.5 good, Doc?
That's good. So we're just going to do 0.5, real easy. As Patrick said, really like the idea of the lights coming on so you know that there's movement. But now look what Ken's doing. He's now working his thigh muscle. So if I need to go ahead and I have muscle in which it's really tight and I can't release that muscle unless I'm going to go ahead and I can increase the movement of the muscle fibrils, this is a great way to do it. It's functional. It's proprioceptive. I'm getting a lot of neurological feedback by doing this. It's a great thing. I can work any part of his thigh. I can work his hips. I can work his buttock. Any area that I want to, I can do that. And that's the beauty of being able to do the hose. So the only thing that limits you on doing any kind of rehab protocol in this pool, and again, I can't stress how nice this pool is and the fact it goes through a 36-inch doorway. You can go ahead, put this in your house, plug it in, put water in it, it's ready to go for you. Now we can do everything that we did on our big pools, we can do in this small little pool. So it's really good. So if we had someone that has a knee replacement, they have a hip replacement, any of those things, our protocols are going to be somewhat very similar as far as the fact that, you know, the biggest thing we need to do is just increase that range of motion. So as Ken's showing you, we can just go ahead, increase his flexion because we know flexion is something he wants to get. Now, when Ken brings his knee above like he's doing there, now we're getting hip into there. So we not only had his knee motion, we had his hip motion. So we can just go ahead and do any kind of movement pattern that we want to. So again, the flexibility, the ability to do all different kind of movement patterns, whether it be simple, purposeful movement patterns, complex movement patterns, they're all available to us in being able to use this type of pool. And the beauty is Ken can watch himself up there. So he can see everything that he's doing if he wants to see how my feet are moving. If I'm having any issues, he has that ability to do those things, okay? So now, as far as being able to go ahead, when someone has an injury, all right, whether it be just a simple slip fall, let me tell you about myself. I hate to talk about myself, but I just broke my foot, okay? I'm supposed to be in my cast. I took it off so I could do the webinar so I don't look like a handicapped individual. But I took it off, and I'm walking on the fracture. Now, I'm not, and I shouldn't be able to do that. I was supposed to have it internally fixated. I was in my HydroWorx pool 3 days after my injury. Why? Because I had to start allowing the ligaments, I had to start allowing the muscles, had to start allowing all those things to free up. So whether we have a post-fracture, whether we're post-hip replacement, knee replacement, whether he has lower back pain, any of those different things, we can now start in being able to do that. Again, he has the handrails if he wants to hold on because he gets a little bit tired, he can. If we want to go ahead, let's take him back up to a run. And let's take him up to a pretty good run at this point in time. We're going to take the hose off. Again, Ken can do that for us. We're making it difficult because we keep the treadmill moving for him, so we're not being very nice to him. So we're going to take him back, and we're going to let Ken go now into a nice run again for us, because I want him to get a good workout before he leaves today. Let's take him up to 2.5. So we're going to get him really moving here, and then we'll give him a jet to work against there. And remember that jet up front, we can go ahead, that's directional. We can hit more to his chest wall, we can hit more to his belly, whatever area I want to, depending upon what I'm trying to accomplish with this patient, I can do that. Now the beauty, Ken, I want those arms moving, swinging. Let's get those arms moving, because it's important that we see this thoracic spine, the area between your shoulder blades. We want to see that moving. That's important for us because that's all about increasing flexibility. If we increase flexibility, less chance of us falling or having an injury. So it was great. Hopefully I covered a lot of the beautiful features of this pool. This is, again, first time Ken's been in it. Ken, now you've been able to run a little bit. Does this feel similar to what you did with the big pool?
Oh, yeah.
Okay.
Almost identical.
He says it feels almost identical to what he felt when he was in the 2000, but again, it's in a very small, compacted area, but he's got all that motion. Get a little bit more arm motion there, buddy. He's a Marine. Those Marines are real restricted kind of guys. We want to get a little bit more going there. Now he's getting moving. Now he's getting a lot more motion. Look at that nice stride he gets. Let's kick out the stride a little bit. Let's lengthen it a little bit for you. So again, we could take him from being able to walk if you're 90 years of age. If you're 75 years young, as this man is, he can get into a nice run. And I know one of the things that Ken really wanted when he first came to our clinic, he wanted to be able to run again because the Marine, they love running. I don't know why, but they do. So Ken wanted to get back to where he could run again. Once he got in the pool, he's a happy camper. Now he can get back and running. Now, if you have any questions, we'd love to hear some questions that you might have. So if you could just send them through, we'd be more than glad to answer any questions that you may have. Reference to the pool, reference to any additional protocols you might want to see with the pool, any of those things that we can do for you. Again, the chair being in there gives us that opportunity to work on squats, gives us the opportunity to work on being able to do a purposeful movement, of being able to go from a seated to a standing position, all this being incorporated into a very small area, but while it's a compact area, Ken, who's 6'2", weighs 245, had plenty of room to be able to rotate 360 degrees, never had to make any adjustments to the pool. It was available for him to be able to do that. So it made it really nice for him, and you know, I know Ken's a happy camper now being able to run again.
Yeah, the question was, can the therapist be in the water with the patient? And absolutely. You know, if an individual patient has lower functioning level, could be at risk, there is plenty of room for a therapist to be in the pool behind. They probably wouldn't be running as fast as Ken is at 2.5 miles an hour. They could be standing on the side rails on each side of the treadmill. There's about 4.5 inches. Therapists could stand on both sides or at the back and then support that individual in the pool. So.
Sure. Okay. Yeah, the question that we have is how would we use the jets to help out with balance? And that's a great question. So we're going to stop the treadmill now. And Ken, what I want you to be able to do is I want you just to stand on one leg for me, okay? Stand on one leg. Now, I want you to go ahead and hit him with a jet. Now, he's not only got to hold himself there by just the water. The water's going to help him to be able to stand there. So he's got the buoyancy factor. I moved him right into an advanced position with the jets because that's a little bit more difficult for him to be able to hold that posture. But Ken's a total functioning. We don't have any issues. Let's turn the jet off. If we'd had someone that may have an issue, maybe we're just going to have them stand on one leg. They have the handrails to be able to hold on to be able to support themselves, but they can go ahead and just be able to go in where stance, single leg stance on one leg, then go into a single leg stance with the other leg. Hold that for a period of maybe 8 seconds. Hold that posture for us. And again, we want to make sure that he's holding good neck posture, his hips are in good position, everything else, and then he can keep on working from one leg to the other leg. So he can either do that just stationary, but again, remember, the beauty of doing this in water is the fact that buoyancy is holding him upright. I have a lot of patients that come in. Maybe they have Parkinson's, maybe they're MS, maybe there are different types of neurological conditions in which trying to do this with their full body weight is next to impossible. All right? And then they end up looking down because they're afraid of falling. They tighten themselves up. We lose all those things as far as posture. Being able to do it here, he's in great postural position. Water buoyancy helps him, but at the same token, if I want to make it a little harder, I just have him go ahead and I have him work against the jets. We have some hand devices that we can use to be able to go ahead, and if we wanted Ken to be able, Ken, if we want to grab a hold of those. So if I want him to work his arms and get a little bit more arms, so Ken, just want you to do this for me. So you're just going to go ahead. Now, what Ken was starting to do there before, which is fine. Now, right, just keep your arms going this way, but just go ahead and just do your leg position, just up and down with your leg. Yeah. So if we want to do that stationary, we could do that. But now if we make it more difficult, let's turn the treadmill on. So we're going to turn the treadmill on. Watch again, the treadmill's going to come on. So now he's getting some arm motion. You're increasing that. So you can take it in that position, put him palm down, any position you want to. Let's turn around now. Let's go ahead and now let's hit against the jet. So now he's going to have to work a lot harder if he's working into the jet. So now he's going to work a lot harder, working his upper body, being able to do those things. So again, it makes it more difficult. Take them so now your dumbbells are just straight up and down, Ken. There you go, buddy. Now you can do that. So again, we can get upper body movement in there, do all those different things that we can do with it. Now, let's go ahead, let's turn off the treadmill for him. Let's keep the jet going. Now, Ken, all I want you to do now is go ahead and I want you to take and bring him up and down. So now I can go ahead and get some deltoid activity on him, strengthening up his shoulders, being able to do those things. And maybe I want him to make it even more difficult. Ken, while you're doing that, stand on one leg. Now, we just increased proprioceptive awareness. Neurologically, we're now integrating a much more complicated purposeful movement pattern now that we've complicated, and now we have more neurological innervation going on. Go to the other leg and do that for me. Now, the beauty of this, if I have a patient, and Ken's working hard to do this, and he's pretty healthy here. If I have a patient that's fearful, if Ken loses his balance, it's no big deal. He's just going to fall into water. But he's not going to hurt himself. He's not going to fall down and fall against anything. If he falls or does anything, he's right against the treadmill itself, the chamber. He can grab a hold of the bars at any time. It makes it very easy for him. So we can get upper body, lower body, all those different movement patterns. Oh, I'm sorry. I'll shut up.
Okay, thank you, Dr. Hetrick, and thank you, Ken. Greatly appreciate your time today. Thank you, everybody, for tuning in today. Following the presentation, a survey will pop up on the screen. We'd greatly appreciate if you'd take just a couple of minutes to fill out that survey. We greatly value your feedback, and thank you again for your time today. So, appreciate it.